Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 25th of August 2021. So the situation COVID-wise in the hospital is that today we've got 35 COVID positive patients. That is patients who are within 14 days of their first positive swab, plus another 10 who are in hospital because of COVID but are beyond the 14 days. Of the 35, 2 are in critical care. And in that number, many of those patients are poorly with medical conditions, but there are some who are in maternity or who are in surgery who have got COVID but are not in hospital principally because of COVID. So there's a mixed picture, but there's no doubt, I'm afraid to say, we're seeing some people who are very, very poorly with COVID, and we have had 4 further deaths to report of patients who are within 28 days of a first positive COVID swab. So condolences to the families and loved ones of those patients. It shows that COVID is still a dangerous illness, and of the 35 who are in, approximately 1/3 of those patients have not been vaccinated, 2/3 have. Of the 2/3, many are in an older age group, perhaps rather frail, so there's lots of other complexities to the medical stories, but I think it still remains the fact that the vaccination is highly effective, and I strongly urge all adults to complete the course if at all possible. Vaccination is now available to 16, 17 and 18-year-olds, and if you're in the 16-17 age group, you will be called in for a vaccine, so that will come to you from NHS England. Anyone who is 17 years and 9 months older can go on the NHS UK website and book a vaccination, and it looks as if within the 20 to 30-year-old age group, there is a bit of a dip in vaccination. So I think it's important I make the point again that vaccination is both protection to the individual, but it is also part of protecting society. So there is, if you like, a sense of duty to maybe to be vaccinated to help everybody in the community. As far as booster vaccinations are concerned, it looks certain that there will be a booster program, but we don't have the final details yet. So as I've said on this before, if you are eligible for a flu jab, may I suggest you get on and book that, and then we will either link in the COVID booster program with that, or we'll run it as a separate program. But either way, I think it's a good idea to get on the front foot. In terms of community numbers, they've crept up a little bit this week. So Blackpool is at 443 per 100,000. Last week it was 400. Fylde 332. Last week it was 270. Wyre is 373. Last week it was 322. So I talked last week about a sort of plateau. Well, it's gone up a little bit on that plateau this week. And with a bank holiday weekend coming up with quite a lot of social interaction expected, the weather's good and so forth, I think we really just need to reiterate the message about being careful. Clearly in public people are not wearing masks anymore to a large extent, and I think it's an individual choice, but I would wish to stress that if you come to hospital, you will find that we're still sticking to our infection prevention and control rules as strictly as we can, and we will certainly be asking everyone coming on site to wear a mask and to observe our procedures. We've still got visiting restricted because of the numbers, and so the exceptions really are maternity, children and end-of-life care, and the specific details are on our website, so I'd ask you to have a look please before you come in. We're reviewing the visiting situation all the time, and in fact there is a regional meeting today looking at visiting policy across the regional hospitals, so we will review that meeting later on in the day. Our senior leadership team will be looking at that tomorrow, and we're really conscious that restricting visiting causes people a problem, and I assure you, if we feel it's safe to make changes in that regard, we will do. Emergency department remains incredibly busy, and again with the bank holiday weekend coming up, we remain anxious about that. So if I may, I'll reiterate the messages about accident and emergency departments are for exactly that. And if you feel you have a serious life-threatening illness, well, for goodness sake, that's what A&E is there for. But for conditions which are urgent but not an emergency, then it's clear that there is other advice available, either through the NHS website, nhs.uk, or through NHS 111. Of course, pharmacists can give lots of advice, and we've got walk-in centres and GP colleagues who are also available. So please could I ask that you're thoughtful about the way you access NHS services at this busy time. So that's really it for today. A picture of continuation, I suppose. I think we still need to be very careful and cautious, whilst at the same time enjoying some nice weather and a bank holiday weekend. Thank you.